Good afternoon. Welcome to a special edition of Political Paula, which will actually air everywhere because I have learned some things over the past month that I really think I need to share with you because I'm hoping that my experience can help you. And again, I can't go into a lot of details because this is still under dispute, but I do want to tell you some things that I've learned that could help you, like right now, today. And it is about your next medical office visit. Now, look, we all know that the Affordable Care Act screwed a lot of us. It screwed me because it turned what I thought was going to be health insurance for everybody into basically people who make a certain amount of money have to pay for health insurance for other people. I didn't like it. One of the things about the Affordable Care Act that is still the law and that I did like was that both men and women were going to be able, if they had health insurance, to get an annual physical. For us women, we can get two. We can get the OBGYN annual physical, the pap smear, the pelvic exam, all at no cost to us. It's all covered under insurance as long as we're paying the premiums. And same thing goes with an annual physical at your family doctor's office. Or so it was supposed to be. Now, most family doctors who do annual physicals require blood work. But it's so important how these blood tests are coded, how the physical exam, the doctor's office visit is coded. And herein lies the problem with some doctors. Let me just please, 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 not all doctors, okay? There are a lot of great doctors out there. There's a lot of good family practices out there. But unfortunately, I get the good luck or bad luck of having the ones who only care about money. They care about the cha-ching. They're timing you when you go in. I did a show about that. The meter is always running. You go over a certain amount of time, all of a sudden you got to pay, 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 even though it's an annual exam where you are supposed to tell your doctor what's been going on since they last saw you. In the situation I'm talking about, it was 3 years since the patient saw the doctor. No health issues, no emergency room visits, no prescription drugs, no diagnosed illnesses. And yet, when this patient called and said, I want an annual exam, the doctor, when he ordered the blood work, coded the blood work as a general illness blood test. Well, see, no, he shouldn't have done that because, first of all, he hadn't seen the patient in 3 years. So he had no idea if the patient had any illness or any complaints whatsoever. Patient just said, I want an annual exam. And it was the doctor's office that said, we'll come in on this date for the blood work, and then I'll see you a week later after I get the blood work results, and we'll have your exam. There was no illness at the time of the blood work, and yet the patient now is being charged because of the way the doctor coded the blood work for a portion of the blood work, which in my opinion, and according to the Affordable Care Act, should not have happened. And by the way, the health insurance company agrees. Imagine that. The health insurance company is actually helping in this situation. They have told this patient that they need to file a grievance and report the doctor for overbilling, for improper coding, and that's exactly what the patient is going to do. Okay? So this is the lesson I've learned. And without going into a lot of details, because I think you've probably already kind of figured it out, that this is something that's very personal with me, and I can't really talk about it till this whole thing gets figured out, which should happen within the next 30 days. But here's something you can do right now. So I'm giving you some advice. Because the insurance company actually taught a certain person something. You have the right when you go into a doctor's office and schedule any kind of blood work or an exam, you have a right to ask the doctor point blank, how is this visit going to be coded? And they have to tell you. They have to give you the code. So if you call on the phone and you say, hey, I want an annual exam, and they say, come in for blood work, then you get to say, how is the blood work? What's the code that you're going to use when I get the blood work? Because I want to call my insurance company and see if this is covered. Okay? You have the right to do that. Did you know that? I didn't know that. And I thought I knew everything about how to deal with medical providers and health insurance. I thought I knew it all. I thought the health insurance companies were the bad guys. Oh my God, they've been so helpful. They want to help. They want to help get money back for their client because they agree this was completely coded improperly. That a healthy person is coded as an ill visit when there's nothing wrong with the person. When they're getting their blood work done. It's almost like this particular family practice just saw the patient coming and wanted to diagnose them with something. It's bizarre. That's why Political Paula's on the job. That's why I have been a little lax in responding to you guys. Because I am working like 24/7. This has been my full-time job since January 11th. When an EOB showed up and I was like, are you kidding me right now? This is not right. So, here's what I want you all to do the next time you make a doctor appointment. And you have the right to do it. Have your insurance card right there. And if your doctor's appointment, when you schedule the appointment, you ask them right off the bat, how is this going to be coded? And they have to tell you the code. They will give you a code. It will be a number. And then what you're going to do is you're going to call your insurance company and say, I just scheduled a doctor appointment. This is the code that they're planning to bill you for, the insurance company. And then the insurance company will explain that code to you. They will let you know what you are being billed for, what you are being treated for. If you are calling for just an annual exam, you just want to know the state of your health, there is no way that any doctor should code it as an ill visit. As long as they haven't seen you within the last 12 months. Because an annual exam is something that the Affordable Care Act guarantees you. It's one of the best parts of the Affordable Care Act. You actually get to go to the doctor, get blood work done, and not pay out of pocket for it, as long as you're paying insurance premiums. It's a gift for having health insurance. But when the doctors start being so money hungry and only care about money, and they only see you instead of as a human being, they see you as a dollar sign, and you actually dare to ask a question during your visit, and it goes past a certain amount of time, like, it's over 15 minutes, now it's an ill visit. Start asking. I would tell all of you exactly what I'm going to do the next time I go for a doctor's visit. I'm going to ask before I talk. I'm going to say, excuse me, I'd like to say, how are you? But if that's going to take time and it's going to go into an ill visit, then I don't give a fuck how you are. I really don't. I don't care how your kids are. I'm not going to ask after the family. Just let's get down to business. Let's talk. And you tell me before I start talking about what's going on with me, which is what an annual exam is actually for. You see your doctor once a year, face fascia, fascia. Don't you want to tell them, oh, there's a little lump here, or, I've been having some pain, I've been having some diarrhea. Don't you want to be able to do that during your Affordable Care Act annual exam? Isn't that what it's for? But guess what? Please don't do it. Because the second you start talking about diarrhea, or a little lump, or a little ache and pain, it turns into an ill visit. Unless you ask ahead of time, may I tell you about something or am I going to be billed extra for it? This is what we have to do in America today. We have to ask before we talk to a doctor. Because if you don't want to end up getting billed for something you really feel that you shouldn't be getting billed for, you have to ask first. Now, the good news is they have to tell you in advance if they're going to be charging you for something. So it's your job, and that's what I say, advocates for love, be your own advocate. Do not trust anybody. You ask the question. Don't be afraid to say to the doctor, well, what do I get at no cost to me? That's what I would say first. So the Affordable Care Act says I get an annual exam with blood work. What do I get at no copay, no deductible, no cost to me? Ask the doctor. And if he won't tell you, find another doctor. Because they have a right they have an obligation to tell you. They have to tell you. And if your doctor says, well, I'll check your blood pressure, I'll check your height, your weight, I'll do a, very minimal blood work like your cholesterol level, and that's all you get, then at that point you have the right to say, then that's all I want. But see, so many patients don't know that they should be asking these questions. If you don't want to pay for your annual exam, then before you walk into that office, before you let them put a needle in your arm and draw your blood, ask them. Let them know you only want the Affordable Care Act annual exam. You don't want all the extra bullshit, like telling you that next year, because you're going to be 50, you're going to need a colonoscopy and blah, 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 blah. You don't want to shoot the shit with your doctor. If you're friends with your doctor, great. Don't use the physical exam to catch up. Invite them to dinner another night. Then you can catch up when they're off the clock. Because today's doctors, I am so sad to say, because they have been bought out by insurance companies like UPMC Pinnacle, they have to meet a quota. They have to see so many patients a day. They have to bill so much a month or a year, and they're being watched. And if they don't do what the new corporate owners of them, I'm working on a show actually right now called The Death of the Family Doctor, because there really is no family doctor anymore. My grandmother had a family doctor. He was a doctor who lived in the city above his practice. His wife was his receptionist, and he only took cash. There was no health insurance issues, and he would make house calls. That's a true family doctor. When you called them on the phone, his wife answered the phone, and the doctor picked up the phone and said, what's going on? And you didn't get a bill. But the real family doctor is now dead in America. And if you have one or you can find one, good for you. I am currently looking for a real family doctor, someone that I don't have to be afraid when I walk into the exam room to say, hey, how you doing? What about this weather? Because the clock's ticking, and that just wasted 2 minutes, and now I might go over and I'll get billed for an entire extra visit. And I'm talking the difference between $170 to $380. That's the difference. That's how these doctors roll. They are overbilling your insurance companies, which makes your premiums go up. And the insurance companies aren't actually really paying them what they bill. What they're doing is they're saying, well, first of all, you overcharge, so we're going to deduct that. Then we're going to pay you this, and then we'll put the rest of it toward the person's deductible, and then the patient has to pay a copay. But see, we are not supposed to have to pay copays for annual exams. We're not supposed to pay copays for drawing blood for an annual exam, for a well visit. We're not supposed to do that. And yet, for some reason, there are doctors in our midst who code and they know what they're doing, even though they tell you, I don't know nothing about coding, I don't know anything about billing. Well, bullshit. The doctors put the codes on the chart, and the billing people read the codes and bill the insurance company. That's the way it works. So if a doctor tries to tell you he doesn't know anything about billing, well, he knows what the codes he's writing on your chart mean. He knows if he's coding for a well visit or an ill visit. He knows when he orders blood work if he's ordering preventive blood work or diagnostic blood work, and there's a huge difference. It's amazing to me that I am a little old housewife in Lancaster, Pennsylvania, who is criticized constantly for not having a job. And I would like to ask all of you who criticize me for not having a job, you think I have a job now? Because for the past 6 weeks, all I have done is work. I have been researching all this crap all over the internet. I have been talking to former patients of this family practice. I have been researching their reviews. I have been talking to the insurance companies, and I have been talking to other doctors. That's what I've been doing. So for those of you who say I don't work, well, I tell you, I need a vacation right about now. And when this whole thing is settled, I will report to you what happened. It's going to take about another 30 to 60 days to get this resolved. But I will definitely keep you updated. But if you think I don't work, well, maybe I don't work every single day. I don't put in the 12-hour days that all of you hard workers who go out there and earn a living to support your families do. But I will tell you this, when I'm needed, I work. And I work damn hard. I'm exhausted. And it's only 2:30 in the afternoon. I'm ready to go to bed. That's how tired I am from my morning of writing letters, of talking to people, of doing research. So be careful when you criticize somebody because you really don't know. In the past several weeks, I've lost about 6 pounds. Many of you can tell I've lost 6 pounds. I've been busy. Too busy to worry about food, too busy to worry about eating. So I just wanted to make sure I came here today to tell you what I know, what I've learned. And what I have learned is that you cannot ever, ever not be your own advocate. You have to ask questions. So please, 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 the next time you have to schedule any kind of lab work, testing, a doctor's appointment, talk before they poke and prod. Once they start poking and prodding, the clock's ticking. The meter's running. You're going to get billed for it. Ask them in advance. How is this visit being coded? Call your insurance company before you go and say, is this covered? And then you get to make the decision. Of course, if you are really seriously ill, you're gonna do the visit anyway. You're gonna do the testing anyway. But if you're simply walking into the office for an annual checkup and they start charging you all this crap, then you do have the right to say, wait a minute, I just want the Affordable Care Act annual exam. And I think that's a really good way to start a conversation with a doctor. Maybe it'll remind them that the Affordable Care Act still is the law. So I just wanted to come on here and tell you guys this. Like I said, I've been pretty busy. And I'm sorry if I haven't been answering comments the way I should, but I will try to do better. I'm done writing my letters, so my letters are finished. So that's a good thing. And they will be in the mail shortly. And when I get a response, I will certainly let all of you know. And remember, not all doctors are all about the money. So sometimes, as inconvenient as it may be, look for another doctor. Ask for references. Ask your friends. Do you have a great doctor? How long have you been with them? Ask for personal references, not the online references. Ask around. I don't believe that all family doctors are truly dead. I believe there's still some good ones out there. And I really hope that the one that I just picked for our new doctor is one of the good ones. I've heard that it's a pretty good practice. So I'm looking forward to meeting the new doctor and really looking forward to finishing up with the old doctor and the money grubbing doctor and the one who doesn't care about patients, only cares about numbers. So I'm looking forward to that. And hopefully this thing is going to be resolved in about 30 days. I will let you know. In the meantime, please, hashtag advocates for love. If someone you know is being treated by a doctor and you think they're not getting good treatment, if they're being overbilled, say something, do something, report them to the insurance companies, because again, insurance companies you may think are your enemies, but you know what? Why do you think our insurance premiums are so high? When I had a mammogram a couple years ago, the imaging center billed my insurance company $600 for a mammogram. $600. But when I called when I was uninsured and asked what it would cost, it was like $180, $200. They're overbilling to get more money out of insurance companies because they see the insurance companies as the new big pockets. And every time an insurance company has to overpay for a mammogram or a pap smear or blood work, guess who pays? Not the insurance company, you and me. People who pay premiums pay for every overbilling that is sent to an insurance company. There is no way in hell that a 15-minute office visit at a doctor for an annual exam should cost anybody $380. And that includes the insurance company. And that's all I got to say about that. So be vigilant, my friends. Be your own advocate. Ask before you go. Ask before you get injected or prodded or poked. Ask. At least then you can save yourself the 6 to 8 weeks that I've been spending when you have to dispute a miscoded bill. Political Paula is out.